You've either heard about, experienced, or are experiencing the torturous practice of physical therapists cranking or pushing on the knee either bent or straight after a total knee replacement. Not only is it barbaric, but it's ineffective, unnecessary, and stupid. Don't let it happen to you, and I'm going to tell you why you shouldn't. Be sure to subscribe, as our next video will be on the best times to stretch and the best and worst stretches you can do yourself. Hey, it's Glenn here from Mehab, the world's leading physical therapy alternative, where we educate and empower you to take control of your recovery. If you're new here, make sure you click that subscribe button. All the links we mentioned in the video can be found in the description below. As always, this information is meant for education and demonstration purposes only. With that out of the way, let's get into it. I read and hear horror stories all the time about patients screaming or crying in therapy from the physical therapist pushing their knee either straight or bent. It's what I learned in school. I even used to do it. I just didn't know any better back then, but now I do. I'm going to explain why I stopped and why you should not let it happen. So why do therapists still do it, and why do patients allow it? There seems to be three main reasons why it continues. Number one, it's just what you do. Sadly, not only physical therapists, but patients also believe that this is just the way it's supposed to be. It's become so ingrained as to what to expect that some patients feel like it's almost a rite of passage to go through it. It's just insane. Yes, a lot of therapists still do it, but I assure you it's not based on any evidence in support of it. In fact, it really flies in the face of what the research says. It has become such an expectation that some patients believe they are not getting quality treatment without it. Number two, it increases range of motion. Again, patients and providers truly believe that this is going to increase their range of motion. Unfortunately, this is not the case. I know people are already saying, it does increase my range of motion, I've seen it. I'm not going to argue that after there will be an increase in range of motion, albeit with an unnecessary risk to healing tissue. I will, however, dispute that the increase will create a permanent change. The change you see is only temporary, and within 5 to 10 minutes you'll be right back where you were. Stretching misconceptions is in another video I'll link in the description below, where I discuss this in more detail. But for now, just be aware that the increased range is going to go away, and quickly. Ever notice range of motion measurements are generally taken pretty quickly after being stretched or a stretching activity? If they waited 10 minutes without additional stretching, there would be no change. Number three, it's essential for recovery. Yet again, this belief is shared by patients and providers. Some providers believe that it's a skilled and essential intervention, and its absence will result in poor patient outcomes. Many patients have also bought into this. It's a belief bolstered by other patients who claim without it they would never have recovered as well as they did. Unfortunately, that provides little support to the argument, as there's no way for them to know that they wouldn't have recovered just as well without it. This goes against what the evidence shows. So why should you stop it? Number one, you already have full range of motion. Despite common belief, stretching does not change tissue length. The tissues around your knee are not short and tight. They are fully capable of achieving full range of motion. How do we know you have full range of motion? Well, because your knee has already been moved to both range of motion extremes. On the operating table after your prosthesis is placed, your surgeon fully flexed your knee to end range and straightened it all the way out to check its function. This proves that tissue length is not the limiting factor in your range of motion. If it was soft tissue limiting your motion, despite having your degenerated knee surfaces replaced with the nice new smooth joint surfaces, you would not be able to get full range of motion on the operating table. Shortened tissue would stop the knee from fully bending and straightening, but it doesn't happen. So why do you not have full range of motion shortly after leaving the operating room? During surgery, your body has not had enough time to have an inflammatory response to the tissue damage that occurs during surgery. But 24 hours after a surgery, it's in full effect. There will be pain, bruising, and a lot of swelling. All that swelling makes achieving full range of motion impossible. Key points. You had full range of motion on the operating table. Soft tissue length does not limit your range of motion. Pain, sensitization, and swelling limit motion. Number two, healing tissue can be easily damaged. Following on from the last point regarding the inflammatory response, there are several stages of healing and scar formation, and the level of tissue tolerance to stress varies greatly for them. These stages do not have isolated starts and beginnings, but overlap into each other. Keep in mind this is a very simplistic explanation of a rather complex system, but it's accurate nonetheless. The first stage is the inflammatory stage, as I mentioned. From the initial incision, the body begins ramping up its response to the trauma. Remember, surgery is nothing more than controlled trauma. To your body, excluding the benefit of a sterile environment, it's all the same thing. To it, the damage can be done with a scalpel or a chainsaw. It does not care. The body immediately starts to clot damaged blood vessels and send the good soldiers in to start cleaning up the damage. This results in redness, heat, and swelling. This also increases pain and sensitizes the area in order to protect it. Next, the body starts the proliferative phase, where it begins to rebuild the structure of the damaged tissue and creates new blood vessels. The new structures are incredibly weak and have a poor tolerance to load. Excessive stress can easily tear the healing tissue, resulting in more pain, more redness, and more swelling. This phase starts in the first few days and lasts for around 2 to 4 weeks. Motion is important at this stage, but it should be very light and intermittent. The pushing by your therapist without a doubt is going to push the healing tissue beyond its tolerance. This is why people often feel worse after therapy. The excessive force essentially has restarted the entire inflammatory process again. Key points. Initially, healing tissue is fragile. Excessive forces will re-injure it. Movement should be light and of short duration. Number 3, it does not improve recovery. Another common belief is that without it, the so-called skilled intervention, recovery is not possible. As a physical therapist myself, I wish that was true, but it's not. There is a growing body of evidence showing that a structured home program achieves the exact same result. Of course, there are people with other complex health issues that may require more in-person treatment, but for most, they will do just fine. In fact, there are a growing number of surgeons that do not even send patients to physical therapy. There are definitely other benefits to physical therapy if you're fortunate enough to have the time, money, insurance to attend, but stretching the knee is just not one of them. It's important to note that even if having your knee cranked on for 20 minutes in therapy was actually beneficial, which it's not, without being consistent and compliant with your exercises at home, your recovery will be difficult. It's your work at home that dictates your ultimate recovery level. Key points. Stretching by a therapist does not improve your recovery. A structured home program provides the same results as traditional care. Consistent compliance to home exercises dictate outcomes. The need for stretching by your therapist is a misconception. It is based upon flawed beliefs and misinformation. There's just no upside for patients. It adds little to no benefit to recovery, and I personally believe it does more harm than anything. It can easily exceed the force tolerance of healing tissue, resulting in increased pain, swelling, and decreased function, and can cause significant fear and anxiety for upcoming visits. It's your consistency with home exercises that will have the greatest impact on your recovery. If you have any questions or comments, please leave them below. Make sure you subscribe to our channel to catch the best and worst stretches that you can do yourself. Thanks for watching, and we'll catch you on the next one.